Hi, everyone. I think we're ready to start, right? Okay. So welcome to Eastern Europe and Caucasus MEL Session. And thank you for taking time to be here today with us. We were preparing this session with a goal to share some insights about learning from the research that we accumulated during our work in complex environments. So the next 90 minutes, we will spend on the discussion about innovative tools and approaches that we applied. And then the second block will be about what it led us to and how it helped to pivot the programming. We will briefly describe the context of the country. We have 3 countries today. It's Ukraine, Moldova, and Georgia. And then we would be happy to address your questions. You can put them into the Q&A section. It's on the bottom of your Zoom. But first, let us introduce ourselves. My name is Maria Valyavka, and I'm from Ukraine. I work as a research, monitoring, evaluation, and learning lead with Chemonics. And I'm happy to pass the ball to Molly.
Hi, my name is Molly Cannon. I'm based in North Carolina in the US. I'm a director of measurement and learning for Palladium. I've been supporting the work in Moldova and several other countries. Thank you.
Hi, everyone. My name is Camelia Gheorghe. I am working at Palladium in the Data Informatics and Analytics Solutions team. Currently, I am based in Chișinău, serving as Chief of Party of Data for Impact project in the Republic of Moldova.
Hello, everyone from Georgia. My name is Uçava Ramashvili. I'm based in Georgia, Tbilisi. I'm 32 years old. For the last 6 years, I have been working for Chemonics International under USAID funded project as a human and institutional capacity and partnership development manager. I just moved to Mercy Corps as a COP for the Austrian Development Agency funded project as rural development through youth entrepreneurship in Georgia. Thank you.
Hi everyone, I'm Andriy Driga. I'm a country operations manager in Ukraine for SEED, the Center for Sustainable Peace and Democratic Development. And we are, with our partners, implementing social cohesion and reconciliation index in Ukraine and in a few other countries as well.
Good morning, good afternoon, everyone. My name is Jared Langlois. I am an M&E advisor for USAID OTI, working with the Ukraine program.
Thank you, and thank you to speakers. Some of them were awake very, very early, so thank you for being here. We will start with context. I want to briefly tell you the situation in Ukraine. I will share my screen now. Okay. Oh, sorry. Can you see it?
Not the full screen, not the full screen.
Yes, it's that one.
Okay, thank you. Good. So Ukraine is the largest, maybe you know, the country in Europe by area, and it has been living with war for the last 8 years. We have around 14,000 countrymen who lost their lives because of the conflict. And Ukrainians across the country have welcomed more than 1 million of IDPs into their communities. Well, we tried and we integrated IDPs. It was sometimes chaotic, but fundamentally we have free and very tolerant society. As Professor Vinitsky has put it, since 2014, Ukraine has passed the ultimate statehood test. Due to the Russian seizure of Crimea and subsequent invasion of eastern Ukraine, Moscow now occupies around 7% of Ukrainian lands. We call these lands temporarily occupied territories. Putin makes no secret on his ambitions to conquer entire country, while his regime works tirelessly to destabilize and divide. The fact that so much of Ukraine has remained unified and intact despite Russia's plans is a testament to the courage, first of all, of the Ukrainian army, but also volunteers, and to the fortitude of the entire nation. And we also have changed during these 8 years. We became stronger and more resilient. Now we see Russian military buildup at Ukraine's borders and prepare to defend our country even more furiously. We are deeply grateful for all assistance provided by Ukraine's international partners. And in Ukraine Confidence Building Initiative, and as well as in other development projects in Ukraine, we apply evidence-based programming to ensure that resources from the provided assistance are spent in the most effective and efficient way, and that we put our efforts in the place where it's needed the most. So today we will describe a few quantitative and qualitative tools that we use for this purpose. And we will start with the quantitative tools known as score index. And I want to invite Andriy. Andriy, the floor is yours.
Thank you, Maria. Hi, everyone. So the Central for Sustainable Peace and Democratic Development is implementing Social Cohesion Reconciliation Index. Can you please, Maria, press to the next slide? Presentation. We don't see the presentation. Sorry for technical things. So I could start actually. So yeah, Social Cohesion and Reconciliation Index, or simply SCORE, is a tool for better understanding of drivers of main outcomes of interest, like suggest intergroup harmony, let's say, and for identification of entry points with the most likelihood of impact for transformative peace. Ray, can you please make the big screen? Yeah, thank you very much. So yeah, as I mentioned, Social Cohesion and Reconciliation Index combined, we call it SCORE. So what is this? So the SCORE content framework makes sure that we do not silo issues, sectors, different domains, and we take the holistic approach while we discovering the resilient social cohesion. And also it gives us opportunity to understand the interplay between them, political, humanitarian, economic, gender, youth inclusion, so on and so forth. Next slide, please. Next slide, please, Maria.
Yeah, just a second.
Yeah, since 2012, SCORE has been rolled out in over 15 countries, conflict affected or post-conflict. We could see Armenia, Bangladesh, Cyprus, Iraq, many of them. Each time SCORE is adapted to a given context for a given community, calibrating the SCORE methodology for different outcomes of interest, pursuing different research questions to identify entry points for particular social change goals. This makes measuring social cohesion more meaningful and policy relevant. You can see different topics in focus for many countries. The first wave of SCORE was done in Ukraine in 2016. And it was conducted annually, providing cross-sectional and longitudinal insights. By 2022, it has more than 200 indicators for 13 dimensions: human security, governance and services, civic activism, political orientation, and many others. We have covered the whole country, inclusive with hard-to-reach area from non-controlled by Ukrainian government areas. And this time we collected the data from more than 19,000 respondents along Ukraine, inclusive with specific demographic and regional boosters, such as areas around the contact line of conflict, areas of near the Sea Azov Sea area where we had those confrontation 2 years ago, veterans, peoples with disability, IDPs, youth, many others. We have established a unique partnership consortium around SCORE in Ukraine, where our index is supported by USAID and UNDP and serves their purposes, as well as purposes of national and regional policymakers, civil society organizations, media, researchers, and practitioners. Please, next slide. Here is an example of one of indicators that scores could cover on the range from 0 to 10. We might see that attitudes towards the future of the temporary occupied territories with the option remain the part of Ukraine on the national level is quite high, but it differs from oblast to oblast. And this kind of oversight gives us an opportunity to see what regions or communities are detached from the rest of the country of their regions. The next slide, please. SCORE also has different approaches where we could have regional and community lenses, community level lenses, that we could focus on specific regions, allocating helps, resources to support, in this particular case, our promotion of COVID vaccination, let's say. And we might see that, next slide, please. So some particular areas needs some additional help, and it's needed the most. So next slide. Advanced statistical analysis, predictive modeling, past analysis help us to identify root causes of phenomena in focus and give the tailored programmatic and policy recommendation. But most of all, the next slide, please. The SCORE is not just a tool. The SCORE is a process, and our process cycle ensures that this process is inclusive for participation of all stakeholders. It makes sure that the process is not determined fully by experts and academicians, but also will help people in need and people who provide this help to be part of the process from start to finish. Annual utilization of SCORE, alternating from national to regional perspectives, gives us an opportunity to not only assess the existing intervention, but also validate, guide, and inform the design of the upcoming activities. And now I'd like to pass the ball to Gerard to build on the top of that quantitative instruments. Thank you very much.
Good morning, everyone. The SCORE index, as Andre has pointed out, has been used in Ukraine since 2016. And what we as a project, a USAID project, OTI project, has found out is that, we have made a lot of strides in certain areas and certain oblasts and communities, but we really lacked a little bit of a nuance to understand where we had hit and how we had contributed to any of the increases in SCORE that we have seen. Next slide. So the one thing that Maria and myself have been doing over the last year is going into certain communities where we have seen increases in certain indicators like social cohesion, social tolerance, or civic optimism, and doing outcome harvesting with our grantees and some beneficiaries in some cases to look at like how and where and why we were able to make these gains. We used the OH method over like a 3-day workshop with about 15 grantees in 2 different oblasts and from 4 different cities in Azov and Ivano-Frankivsk. These outcomes were where we have seen the grantees have seen relationships in the 3 overarching SCORE indices that on 3 of the overarching SCORE indices that Andre pointed out. We wanted to look at how these grantees could have plausibly contributed to improvements. Now, like I said, this could have been in terms of social cohesion, which also included civic activism, active citizenship, community cooperation, a sense of agency, civic engagement, or trust in NGOs, or social tolerance, which also could include social tolerance towards LGBT community, pluralistic identity, which Maria hit on, social proximity towards people from Eastern Ukraine, or civic optimism or pride in locality. We'll get into the findings a little bit later, but what we found was like the ability to use outcome harvesting, where we were able to like harvest significant outcomes from the participants, outcome chains from the participants. We were able to see, like, using the methodology, at least 2 to 3 major outcomes where they had contributed to one of these indicators, which had subsequent outcomes that built up to a major outcome that contributed to the indicator. We then looked at how they contributed to that indicator by looking at all the factors that they may have had a part in making that indicator rise over the last 2 or 3 years. These outcome chains and contributing factors, using these outcome chains and contributing factors, we use qualitative comparative analysis to analyze the different factors and determine like how and when we should be basically double downing on a certain factor in order to increase the likelihood of improving social tolerance or social cohesion in a certain area. These partners collaborated to find this interconnectedness between where their outcome chains and their ability to produce these outcomes had some sort of interconnection. We also used a methodology called the rich picture to ensure that the interconnectedness of their work was represented in the picture. I'll let Maria walk you through the outcome. This is a rich picture that we developed in Ivano-Frankivsk, which shows how the interconnectedness of the partners is really evident in their work. And I'll let Maria talk you through the rich picture.
Yeah, thank you, Jared. Well, rich picture is an interesting tool because you can never prognose what it will look like at the end. So it's even interesting to watch the process, how partners collaborate and decide on what they will put on the picture, what is important for their region, where are they right now, with whom they cooperate, and where do they want to go. So in Ivano-Frankivsk, we observed that it was hard for participants to find that common decision and even to approach the mapping. So at the end, when we were reflecting on their picture, they said that they don't have that much cooperation between organizations, and it was very clear, and it was visualized with this instrument of rich picture. Here we see many arrows and importance of media with whom they cooperate. So actually the second piece of the picture is when partners describe what they meant by this picture. There is no need to have some art skills. It's just a reflection of their thoughts, often unstructured, but it reflects really what the situation is there, and helps to link it further to outcome harvesting, to collection of things that they've done and what is important to them. Yeah, so it's like in general, and in all regions, it's absolutely different. So I think the results of these methods and tools we will describe in the second section. And now I'm passing the word to my colleagues from Moldova.
Hi, everyone, again. I and my colleague Molly Cannon from Palladium will be presenting today very briefly the experience of Palladium as implementing partner in the Republic of Moldova of 2 USAID funded projects. I'm now trying to find the laser. Just a second. The first being measure evaluation and the second data for impact. Measure evaluation was a project that lasted until 2019, and it supported the Republic of Moldova to better assess, address, and monitor the national childcare system reform. And based on the results of measure evaluation, the current project Data for Impact is continuing the support to the country for better harnessing the power of data for the benefit of children in adversity. Few facts about the project context, about Moldova. So it has a population of around 2.8 million people, of whom 585,000 are children. The main reason why children are outside parental care is the massive outmigration for labor of their parents, counting for around 88% of the cases. Over the last 5 years, the political situation in the country was rather unstable. Moldova has a decentralized government with 35 districts called the raions, 2 municipalities and 2 autonomous regions, and it has the status of associated country to the EU since 2014. The key partners that we work with closely are the Ministry of Labor and Social Protection. When we started in 2017, it was the Ministry of Health, Labor and Social Protection. Afterwards, the ministry split in two. The National Social Assistance Agency, the e-governance agency, 35 decentralized social assistance structures in the raions, and key civil society organizations. And other partners that we are working closely with are UNICEF Moldova, Changing the Way We Care, which is another USAID funded project in the Republic of Moldova. Since we are working with figures and data, of course, National Bureau of Statistics is also a privileged partner of us. And also we are working with several line ministries. Now here on this slide, you see that over the years, we used a large range of research methods to do our work, such as surveys and focus group discussions and interviewing and document review and literature review and secondary data analysis. And you see on the slide, the timeline starting with 2017 until 2021, and at the bottom there are examples of various assessments, evaluations, analyses, researches that we have conducted, and at the top of it you see the results, how the recommendations, the results of all these assessments, analyses, researches, evaluations brought about change in the country in terms of policies, in terms of information systems, in terms of capacity strengthening. And I will now give you some examples. For instance, in 2017, we have supported the government and its partners to conduct a highly participatory self-assessment of the childcare alternative system. And this has resulted in the adoption and modernization of 10 different policies and standards on alternative childcare. Following the assessment of the existing social assistance information system in the country, which was repeated in 2021, we managed to change the perception of key decision makers on the utility of having a case management information system, the need to have longitudinal data, to see how the child is faring within the child protection system. And we have also managed, together with the partners, especially in the Ministry of Labor and Social Protection, and other key stakeholders, to develop the technical concept of the new child management information system, which is now ready to go out for public consultation. Starting with 2019, we have intensively mentored the government and its partners in the process of developing indicators to monitor progress in alternative care of children, violence against children, and performance in case management, based on literature review, secondary data analysis, and indicator piloting. And this resulted in 2021 in 50 indicators ready for institutionalization to monitor and evaluate policy impact and effectiveness on children. And these indicators have informed also the monitoring and evaluation framework of the draft National Program for Child Protection for 2020 to 2026. And also they will be captured in the analytical module of the new case management information system. Another example is related to formative research, such as the M&E capacity assessments that we've done in 2020, which informed a large and complex blended learning operation to improve the capacity of the Ministry of Labor and Social Protection, of the National Social Assistance Agency, and of the decentralized territorial social assistance structures in better using information for decision making. And also you see here in 2021, 228 service providers that are serving vulnerable children and vulnerable families with children that were empowered to collect better quality data to inform decisions for children. And more recently, we started with data review meetings in the country, based also on a desk review that we've conducted mid last year of global, international and national practices of supportive supervision for data review and data use. And together with these data review meetings that we conducted in December, we started actually to conduct in December, we managed already to empower 11 RIOs in addressing various barriers to data use, and also inform the work on developing guidelines on data use as part of supportive supervision processes in the country. I also forgot to tell you that this piloting of alternative care indicators that we've done were used also to collect longitudinal data in these pilot raions, and they showed that there is an increased trend, a very worrying increasing trend of children at risk, and measures were taken by the raions to address the parents' neglect and domestic violence. These are the two main reasons why children in Moldova are put at risk. Now, here you see some highlights of the tool that we used in 2017. As I mentioned at that time, we have supported the government and its key partners to conduct a self-assessment of the alternative childcare system reform in Moldova. And this is some snapshots of the tool that we used. I just want to say from the very beginning that it was not used only in Moldova, but also in other 3 countries, in Armenia, in Uganda, and in Ghana. And in each of these 4 countries, measure evaluation worked with a co-country team comprising of lead government representatives, civil society representatives, key donors, and other partners to enhance the country capacity to assess progress on national care reform, set future priorities, and last but not least, to strengthen country skills in collecting and using data to inform the strategic management of alternative care for children. And on this slide, you see, as I said, 2 snapshots of the tool that was used for the assessment in Moldova. But in the other 3 countries, the structure was pretty much the same. As you see, it was an Excel-based tool. It was structured, the statements in the tool was structured around systems-less assessment framework. And you see here on the first snapshot, some of the system components that were assessed. the leadership and governance, service delivery, workforce, monitoring and evaluation, and information systems. There were the 2 financing and social norms that I was not able to capture here. And also the tool has 1 tab for each area of care. You see, prevention of unnecessary family separation, foster care, residential care, kinship care, supervised independent living, other forms of care, and there was also adoption and system deinstitutionalization. And all the statements that you see here in the tool had predetermined drop-down response options, and the responses were given based on consensus. And really, this was very, very challenging in all countries because the assessment engaged so many stakeholders and there were around 200 different statements. And in order to reach consensus for each and every statement, this really was very challenging, but very happy to report that we managed to do this. And once these responses were populated in the tool immediately, these were reflected in these dashboards that automatically illustrated the results. And this was very good for decision making and for supporting the action planning on the spot and afterwards. And here at the bottom, you see the link where the tool is placed. So please take your time and review it and come back to us with questions in case there is a need for clarification or if you are intending to adapt it for your own country. And I would like to just highlight 3 innovative features of the tool we used. First of all, it was about a government self-assessment of its own system of prevention and alternative care of children. So no external evaluation, no external team of evaluators has been involved in this. So self-assessment for the first time, at least in Moldova. Then, as I mentioned already, it was the first time when a systems lens approach was used in assessing the alternative care. And you see in this small picture some of the, classical system components that were used and assessed: leadership and governance, workforce development, service delivery mechanism, monitoring and evaluation and information systems, financing, and last but not least, social norms and practices. And thirdly, it was the first time when a tool was developed to assess the progress reached by the country in complying with UN guidelines for alternative care of children. So these guidelines have been endorsed in 2009 by the UN General Assembly. And many of you probably know they provide state obligations, but also roles and responsibilities of other actors to ensure that children are not unnecessarily separated from their parents, that any alternative temporary or permanent form of care provide a protective care environment. And in case children are living in residential care and they have a family network, they are given the opportunity to be reunified and finally reintegrated. So thank you very much for your attention. And I and my colleague Molly are looking forward to responding to any questions when the question and answer session will come, but also please be free to also include questions in the chat or in the Q&A section of Zoom. Thank you.
Thank you, Camille. Very interesting tool. Now I'm thinking if probably we need it in Ukraine as well. Yeah, it's very detailed, and but I'm sure there are going to be questions about, and I see already in the chat there are questions, but we will answer them after the next presentation, after the first block. And now I want to invite Ucha for presentation about Georgia.
Hello once again. Let me start with provision of some contextual information about the country of Georgia. The size of the country is 60 9.7 thousand square kilometers, so the country is not that big. The capital city is Tbilisi, and 1/3 of the total population is living in the capital city. Actually, the total population of the country is 3.7 millions. Here I would add that we have quite high rate of migration. Our neighbor countries are Turkey, Russian Federation, Armenia, and Azerbaijan. And the Black Sea is also a very good partner and neighbor of us. Ethnic minorities that I wanted to mention living in Georgia. We have around 7 different groups of the ethnic minorities living in our country. But the major ethnic minority groups are Azeri and Armenian minorities. They are mainly living in the particular regions or municipalities. Also, we have 2 occupied territories, Abkhazia and South Ossetia, which are located, one in west part of the country and other in the central part. The occupied territories represent 20% of the entire territory of the country. And from those territories, we have 300,000 internally displaced people. Georgia consists with 9 regions and 1 autonomic republic. We have 69 municipalities in total. There are decentralized like self-governed municipalities and also 5 self-governed cities. The country is mountainous. The highest populated village is located at 2,345 meters above the sea level. And this information that I have just provided is important and mostly needed for attendees to understand the context of the country in relation with the presentation that I'm going to deliver today. The experience I'm going to share with you today is entirely taken from the project, which lasted 6 years in Georgia and was working with 5 regions, 81 communities, like 17 municipalities, and around 300 villages. Let me go ahead with the presentation itself. I will start with saying that I'm not a M&A professional myself. So the content that I will share with you today is mostly how we perceive monitoring, evaluation, and learning from programmatic perspective, and where are the synergies and what is the value of well-coordinated working approach. Let me share with you at the non-professional language some basic rules that we always consider. The first rule is to have all data collection tools in compliance with project goals, targets, activity specifics, needs, requirements of the potential beneficiaries, considering, of course, specific of the geographical areas, and I will mention this bit later in more specific details, and also the peculiarity of the project indicators, obviously. The rule number 2 that I wanted to mention is to use data collection tools, like simple data collection tools, as much as possible. For example, such as, I don't know, the training attendees sheet, which is, if in case it's enough, let's say, for determination or verification of particular indicator. And this is what enables us to have more energy to concentrate and focus more at more complex issues. Rule number 3 is to use complex tools for diverse indicators, which enables us simultaneous calculation of several cars, which sometimes is result of simultaneous calculation of several sub-indicators. Actually, of course, some indicators can only be verified via survey. For example, determining the perception level on the involvement in decision making on the local level. That's the example that I brought. And the methods that we mostly use for that is face-to-face interviews, focus groups, in-depth interviews, and etc. I can also bring 2 examples of the surveys in the terms that we recently conducted, which are, one is determining resilience index in the target communities, and another one is household survey for determining average income increase in the target communities. In some cases, simple tools such as questionnaires with like 15-20 questions for MSMEs are being used, containing the questions related about the simple stuff like costs, revenues, sales, loans, technologies applied, grants, and stuff like that. This needs actually to provide enough information, but at the same time needs to be optimal and not to overload it with a long list of the questions. And here comes the rule number 4, which says to keep beneficiaries able and motivated to get engaged in data collection in every other time by not taking too much time from them, so that every other interaction feels somehow positive from the beneficiaries' perspective. Now, what I would like to do is to look at COVID-19 pandemics in a way like changes versus new opportunities, because COVID actually brought a lot of challenges to the world, to us, to everyone, but also made us or encouraged us to use more different technologies, different online platforms like Zoom, Teams, or whatever else, more active engagement of mobile interviews during data collection. And these methods were used both for group data collection, individual information collection when it's about confidential information. And here comes one question: will these methods stay in practice after COVID leaves us or not? I think yes, but we will see, of course. Another stuff that I wanted to tell you in this blog is several examples about initial classic approaches and some innovative tools from our experience regarding different topics, and that's pretty much related with the stuff that I mentioned during the telling you about the context of the country. The first topic is working with ethnic minority populated areas, and the challenges that we face here mostly are the language barrier, lack of trust, obviously, then like challenge in terms of identification exact needs and requirements of the potential beneficiaries. And the classic approach over there was to, the initial approach was here to adopt the information materials, having the adopted special communication approach, specific questionnaires, and specific data collection instruments, also in different languages like Azeri, Armenian, plus Georgian, of course. But apparently that was not enough. So one more tool that we used are the data collectors and the interviewers themselves, which preferably were coming from those particular communities and villages, and also we are fluent in the language that the communities spoke at. Advantages that this approach brought us is building the trust, like no language barriers anymore, and identification of specific and exact needs and requirements, which enabled us to follow up with the accordingly planned program. Another topic is working at the ABL communities. That ABL, under ABL, I mean administrative borderline line, which is obviously along the occupied territories. And main challenges here was that the communities over there are extremely poor and trust is really low. And also we needed to take the extra safety measures working in those communities, and same times we needed to consider the contradictions with the state social assistance packages. The initial approach here was also the specific communication approach, which is more sensitive, more person-oriented, but that was also not enough. And the way of having the interviewers, data collectors from the those areas and representatives of IDPs themselves was one and unique tool to keep the beneficiaries open and prevent all kind of data hiding or having the beneficiaries close to the data collection process. The last topic that I wanted to mention is working in the hard to reach areas, and that's, for example, Tusheti region where we were working, which is mountainous region and open to physically access only during 4 months of the year, and other 8 months it's closed because of the snow and the road. The initial method of working there was like active mobile phone interviews during data collection during 8 months, and during 4 months intensive face-to-face approaches, but that was also not enough. And here we have a good example of having a local partner, which was Tusheti Protected Landscape Administration, who has rangers all year around in the place. So we partnered with them. We retrained the rangers as interviewers and data collectors, and guided them also during the data collection process, and that really enabled us to have the data collection on place every time we need it. And at the same time, this is needs to be emphasized. It was a good example of partnership with the external partners. The general key approach, which I wanted to share with you as a last part of this blog, is the M&E, what we experienced. The M&E system was structured in a way that not only the M&E teams or regional M&E representatives or interviewers or data collectors were engaged here, but also internal as well as external partners and beneficiaries themselves, of course, with their own responsibility. And the highlight in here is that M&E teams and technical and program teams were jointly actively engaged in the data collection process as well as a quality control process. That's all for now. Thank you very much.
Thank you, Ucha. Really very interesting, and a lot of actually common things that I see what we have in Ukraine, and difficulties in data collection, hard to reach areas. And it's interesting, yeah, how you approach it as well, right? And I see we have a few questions in our Q&A section. It was a few of them were already answered. Thank you for your interest and putting questions. We are always happy when there are questions. And the other ones we can take before moving to the second block about results. So the first one is from Rainer Woken. Are outcome change the same thing as series of change? If not, how are they different? Maybe Jared, do you want to take this one? Jared is very experienced in TOC.
Outcome chains are different than the theory of change. So theories of change, so if we do this event, people will be able to come together and they will find a commonality between themselves. That would be like a typical theory of change. So for example, we collected photographs for an outdoor photograph event about how people are similar to each other in the eastern part of Ukraine, or southeastern part of Ukraine. But beyond that, the actual higher level outcome and unintended outcome was that the person putting on the event was so inundated and flooded with so many photos, he was able to take those extra photos that we didn't use in our event and create an interactive museum at one of the public libraries that is being visited by school children and people in the community. So it even goes way beyond the event that we had planned. So, first step in an outcome chain for that one, for example, was he got an MOU with the relevant museum and then got additional funding from the local council, for example, and then was able to put on the event. So the outcome chain is actually going beyond a little bit of the theory of change when the theory of change sort of stops and is finished. I hope that answers your question, right?
Thank you, Jared. Okay, and the other question can you speak a bit about how the various partners collaborated with each other? Does anyone from speakers want to take this, or I can? Okay.
Yeah, yes, Omoli.
I could say something on that,
Yes.
you know, which we'll have some of this in the next block on our lessons learned, but I think in Moldova, and actually several of the countries where we implemented the self-assessment, it was really interesting to see people kind of coming together and civil society, putting government, I guess, the lead ministry in the role of facilitator was really a major effort, right, to work with them, to engage with civil society, and on the spot have to deal with disagreements on those different statements, right? So, you know, I remember in one of the countries, it wasn't Moldova, but in another country, in one of the workshops, you know, there was someone from government saying, I don't like this democracy, you know, this democratic approach to dealing with this, which I thought, you know, was interesting. But when you're together for 3 days and you've got people from subnational level also discussing with civil society, you know, with the government ministries, the accountability was really put forward on that lead ministry in a way that I think other methods that we have used in the past, you know, if you just hand a report to someone that's been done, that's different. You can kind of shelve it a little bit. But when you're live and you're responsible for facilitating the outcomes of those discussions. So that at that level, I found that really striking and interesting. But Camelia, I don't know if there's something you want to add because you just brought up this map.
Yeah, I just wanted to, you know, initially we had this slide, but then we decided to take it out. But now I think that it's you know, illustrating the way in which we engaged with various stakeholders. So from their mapping and, you know, engaging in the overall assessment process towards making sure that the government, civil society and other partners adapting, reviewing and adapting the tool for the local context, then working together with us on determining the methodology, preparing for implementation, government that sent out the invitations and agenda. And as Molly said, the government facilitated the workshop with mentoring from us. And then the country team that prepared the report and prioritized the recommendations and developed an action plan, which was then disseminated by them, and monitoring of their implementation was done until it was clear that the recommendations of the assessment inform policy and programming. So this is just, you know, very brief picture of the process and the way in which we engaged the stakeholders and the way in which the government then became the energy behind this engagement, and they owned the process. And there was something that indeed illustrated that it was a self-assessment, and that all the recommendations were embedded in actions and then monitored by themselves as well. And we hope next year that they will repeat this self-assessment so that they will see, they will make a comparison between where they were in 2017, where they are in 2023.
Thank you, Molly and Camilla. And I see there is a related question. Maybe we can briefly answer and move to the second block, and the rest of questions we'll answer after the second piece of presentations. Bahar is asking, did the government sustain the work after the support? Because most of the time they are just responsive during the activity. And maybe it's related to lessons learned. If you want, we can move it to the next section, and just to keep in mind this question. Okay, thank you very much. Yeah, so now we are moving to what we've learned and from the tools that were presented, and what are the results. So the most interesting part. Okay, I will share the screen. Okay, so of course we use many tools, but today we were talking about two of them in our programming. So it is score index, the quantitative tool with many indicators which we apply and track since 2016 on the national level, and then outcome harvesting as a qualitative tool. So for instance, with a score, we use it not only to evaluate the results, but also to see where our help or assistance is needed, the type of programming that we apply. So, for instance, after 2018 national survey of score, we saw that there is a need for our programming in the West. So Ukraine Confidence Building Initiative phased in the two Western regions, which is Zakarpattia and Ivano-Frankivsk Oblast. And then after the third wave, which was in 2021 of score, we tracked the change in the index for the most. Our programming was aimed at pluralistic Ukrainian identity, which is actually, there is like a description. It's a degree to which one believes that everyone, despite their ethnic and cultural background, who lives in Ukraine, are an integral part of Ukrainian society. This indicator is very important for the unity, for us being resilient and strong. That's why we track it. And we saw the big change in these two regions. So in Zakarpattia, it increased by 2.4 points out of 10, which is very significant, because if it's more than 0.5, it's already a visible change in the region. And in Ivano-Frankivsk by 0.8. So it evidenced that we have plausibly contributed to results in the region. And that's after this, we combine actually qualitative and quantitative methods. And now I will go to qualitative one. Here also important about score that it's, as Andrew said, it's used not only by USAID programs, but also by UN. And recently, the government of Ukraine also took indicators from SCORE to track the economic development strategy in the east of the country, which is quite big change in evidence-based programming for authorities. So we are very happy about this. And now about outcome harvesting. It's quite interesting technique, because during outcome harvesting, as Jared was describing, we are putting in one room partners from the region. In some cases, they are collaborating with each other and know each other. In some cases, they perceive more each other like competitors for resources or grants. So even after outcome harvesting, there are some changes that are happening with their like cooperation. There was a question about collaboration, so I think it's also related to this piece. But with like big picture that we used, we took 3 indicators, big indicators from SCORE, and combined like actually in meta indicators to put our activities in 3 buckets. Basically, activities related to social cohesion. It's such activities. It's, for instance, there is a bike path which was created. It's partly like infrastructure project, but also related to tourism. Ukrainians love cycling, but we don't have a very good roads for this. But also we have beautiful nature and a lot of opportunities in this field. So it was a bike path which connected east and south of Ukraine. It also united those who love cycling from different regions in the touristic sphere. But then, for instance, such activity as supporting the museum, some exhibitions about the history or unity of the city or the region. We did it in Zaporizhia, which is a very interesting city, infrastructural and industrial city, and with very rich history. Another bucket is related to social tolerance. So basically, all the three score indicators showed quite significant increase in the regions that we were working. So we took it, this change, and we tried with qualitative methods to understand how this change happened, which activities contributed to this change. And that's where the outcome harvesting piece came in. And we were collecting outcomes of our partners. Some of them were refurbishing public space for making it safe for people from LGBT community. And it was like, especially considering the context in which it happened in the region where this topic is not that easy to have, and the dialogue on this topic. So it was very important for the community. Then about civic optimism. Civic optimism means that people think that their future generations, their kids, will live better than they are in right now, so that the country is moving in the right direction and there is optimism for the future. So for this index, there were such activity. Many of them were on environmental issues because communities wanted to become greener, to develop tourism, especially in industrial regions. And yeah, so some environmental practices were put in place in these regions. And then during this outcome harvesting sessions, which usually last like 2 days, 2 full days of partners working together, we collected from them the contributor factors that they mentioned, which helped them to receive these outcomes that they were describing before. And there were interesting trends. These contributory factors are also divided in 3 buckets: causal, persuasive, and supportive activities. And grantees were brainstorming why the success was possible for them. And in these 3 buckets, there were like very clear things that helped them. And different partners from different regions, they mentioned the same things, which may make it like interesting, because if we support, for instance, advocacy campaigns on ecology topics that leverage existing policymaker partnerships, then it's one factor that will lead to success to receive these outcomes. And if the problem the partner is trying to solve, if they have very good expertise and problem statement, it's also contributory factor for causal activities. So actually it was the whole bunch of things and factors that were mentioned, and we only helped actually to structure them and to voice it up, because often our partners, they work very hard but they don't have, they're always running because we have very intense situation. It probably is the same as in your country, but it's very important to reflect and to look back of the outcomes that were achieved, if they are still there, how they changed or something new appeared, and often there is something that grows from these seeds. So we were actually just collecting and structuring, and at the end it led us to learning agenda product with recommendation we hope to share broadly. And there are like few lessons learned on the way. Also, like this combination of qualitative and quantitative tools is important. And we learned that, for instance, quantitative research score and other, they are showing, like giving us a snapshot of the situation, what is happening, what is the situation right now. But to receive answer to the questions why it's happening or how did it happen, we need usually to apply qualitative tools. Then during this qualitative data collection or workshops, it's important not to rush partners because they need time to process information, to process even the methodology, because we don't approach it just as a data collection. We approach it as a workshop, as a training, because partners need to understand how to look at even the difference between outputs and outcomes, and so that they could put them in the outcome statements. And also during these workshops, it's important to invite people of different profiles. For instance, it's not just program managers who worked on the project, but or the head of the organization. It's good to have different perspectives even from the same organization. So it's good to invite people, coordinators or managers or M&E people, so because they add value to insights which group produces. And yeah, and it's always good to plan for follow-up with partners and validate the data you collected. For instance, we can do it like after the activity is over, in a half a year or a year later, and we will find new information and we will see how it's developing. So this follow-up is actually important. It's not that activity is completed and we move, it's good to know what's happening later. So it's like main insights. Now I'm passing the ball to Molly.
Thank you. If you stop sharing, yep, perfect. I can share my screen. Okay. Hope everyone's doing well. Just trying to get, there we go. Great. So I'm going to pick back up. You know, Camelia presented earlier two things. She showed us the timeline, right, from when we started in 2017 to what we're currently doing. And then she really highlighted one of the tools we've used, which was the self-assessment tool that we used in other countries. So I wanted to highlight here really how this informed our overall approach and some of the ways it fostered ownership and cooperation. So these are some quotes that you'll see on the left from Moldova. So that self-assessment, according to this one government representative, said that it helped all sectors involved in childcare reform come together. Once the tool was adapted to the realities of Moldova, it was much easier for us to find common ground and reach consensus. We now have a unique platform for a common approach towards care reform. And I think one of the really interesting things around this country ownership was that when we started this work we looked at a lot of the different evaluations and assessments that had already been done in the country related to different types of care reform. And when we interviewed government representatives and asked them to what extent they were involved in the development of the tool and implementation, of the research, it was often not very much. Usually they had been asked to consult maybe, but not to actually be engaged and participate in the actual collection, of the data, the analysis. So this was sort of a different approach that was brought to bear there. And then we also got some input from civil society. And one of the representatives from a civil society organization where there's a very robust, I think there's about 100 different NGOs working in this childcare reform space, said after the assessment, the cooperation between the government and NGOs and the cooperation among NGOs increased in frequency and quality. We had discussions on ways of leveraging resources for care reform, including advocacy for increasing foster care funding. So because there were so many different areas that touch alternative care, everything from deinstitutionalization of large-scale residential institutions to the foster care, kinship care, unnecessary separation and the prevention measures, there's different actors engaged in different parts of those. So the tool really brought together a lot of these different actors. One exciting result, I think, out of this was that in both Armenia and Moldova, because different actors found benefit to the tool, they actually, modified the tool for totally different purposes. And so that was an unanticipated outcome, right, from where we started. In Armenia, the government wanted to use the tool and they adapted it for assessing reform related to integrated social services. And in Moldova, Keystone Moldova, which is an NGO that really works with children with people with disabilities, they used it to assess the observance of the UN Convention of Rights of Persons with Disabilities in state residential institutions. So the nice thing about this tool was that because it had a systems approach to addressing reform, it's something that can be applied for different types of reform. And again, we didn't really plan for that. And that was exciting for us. I do believe that the approach we used at the very start of our work there set the path for engagement for the entire time we've been working. It's created a curiosity for understanding other people's perspectives. It's really fostered a lot of open dialogue among the different actors. And I think it has facilitated change among counterparts and project team. Is it fully sustainable? Is the government, taking this up and leading it on its own with the assessment, with a repeat assessment? Not entirely, but I think a lot of the structures and the teams that have met and engaged are continuing on. So the next slide here are some key pivots, right? So one way we like to think of our work is, we start with a plan and then we get on the ground and we start to implement, right? And as we start to implement and assess and use this research, we learn things and we pivot and we change. So I think there's some key points that I really want to highlight. Initially, the longitudinal system was supposed to capture just certain types of data, but after, multiple consultations and additional assessments, we expanded the scope of the longitudinal system in consultation with government to include adoptions and repatriations. One thing that we hadn't initially planned to do was to institutionalize data review meetings as part of supportive supervision at the rayon level. So we were mostly working through the national level, and this relates to this next one. And then it became very clear that there's these other organizations and agencies that are incredibly critical, and you have to look at working with the whole ecosystem of actors in the alternative care space. So the National Social Assistance Agency has become one of our key partners, and our colleague who's on the line, Oleg Hinsu, is based at the National Social Assistance Agency, working closely with them, and then important other actors like the e-governance agency. But that supportive supervision is the institutionalization of ensuring that this is happening at community level as well. We've added local universities as M&E capacity strengthening partners. So that was never part of our original vision, but it became clear that we needed to, that one project couldn't do all of the capacity strengthening. And then also because of keeping our eye on the ball and where we were really trying to go with outcomes, sometimes we were getting stuck in moving forward with the constant changes in government actors. And so, you know, really embracing with UNICEF and changing the way we care and having a shared vision with sort of other important actors in the country has really helped us move forward with the vision. So what are some of our key lessons learned? And again, this kind of goes beyond just the tool. But if you frame your research in line with the international standards, so it really helps country counterparts to be more likely to engage in the project activities. That's something we have found. So, you know, we've couched things with the UN guidelines for alternative care for children. We, in all of our systems assessments, rely heavily on the principles for digital development. And we undertook an activity to, you know, look at best data use practices in supportive supervision, and that helped to inform our strategy. You know, I saw Maria had a point before about sort of these larger, like more robust research. It can only, you know, sometimes those things take a long time to execute, and it can take a long time, right, to achieve change. But if we can develop also a series of rapid types of assessments that still use rigorous mixed methods, we can implement agile evidence-based programs. So, you know, and that was the point of our timeline from 2017 to 2022 is we kept pivoting and growing because we're using some of these rapid approaches. If you co-develop and implement instruments with agencies, civil society, multi-sector, then the local ownership of results increases and there's joint accountability. I mean, as I said, we had 10 different policy changes just from the initial self-assessment that was done in the other countries as well. We saw considerable change. There were 54 recommendations in Armenia. Many of them were taken up as well. I think there's something here that's an important part of CLA, which is if you promote and support local staff leadership, right, then you'll know how to address challenging situations, be nimble, and advocate for change. And something we do at Palladium is we have a performance excellence model with coaching. So, you know, this is part of the enabling environment for the staff on the ground, making sure they have all the resources they need to act and pivot appropriately. And then this last point is about having a communication strategy, being really proactive and having scenario planning where we've had different types of roadblocks and engaging with USAID and other multilaterals in the problem solving can be really critical to achieving our goals. So I'll stop there and pass it over.
Thank you, Molly. Okay.
So the lessons learned, success stories, adaptation of the programming. This part of my presentation is very much related to what COVID brought to the world and what we were left with. COVID brought actually quite many difficulties to every one of us, but mainly the beneficiaries with whom we are working and targeting, we are suffering. As for us, we were working mainly in tourism and agriculture fields, so we saw that both sectors faced quite many difficulties. In the process, we saw that our beneficiaries, or at least majority of them, were in deep crisis, And that was even more obvious in tourism field, because the businesses actually were closing after one each other. We started to think about the solution. What we were thinking about is that one was mitigation of the economic risks and challenges, and another issue was mitigation of the COVID regulations and learning how to respond them, which was quite new, and we needed to be very careful in the terms. We decided to elaborate the COVID response plan for the both sectors, for agriculture and for tourism sector. But we also decided that the response plans needed to be evidence-based, mapping the exact needs and requirements. Why? Because to enable us having proper and effective programming on place. So how the implementation process went is we elaborated special tools for survey, data collection, and analyze. We also analyze the last quarter reports. And of course, in a short time, because we didn't have much time for doing all that, and then planning intervention, intervening, and then waiting for the results. So we tried to be on time in that terms. And the main things what we needed was to exactly know the challenges that our beneficiaries in each sector or subsector were facing. And we also needed to segregate our beneficiaries which changed profile, which so to say went out from the market or applied extra digital or outdoor services, and all that information was needed to be on place for having proper and effective planning and dedicated programs to the existing challenges. What we have done is we included all target regions and all municipalities, not to miss any specific problem, and also not to miss anything specific from any target sector or subsector as well. All in all, we came up with a cluster survey, and the cluster was consisted with proportional numbers according to the region, according to the municipality, according to the sector and the subsector. The survey came up with 5 highly required interventions, and this package was swept up and handed over to the program and technical teams for the further and follow-up interventions. And as I mentioned before, that happened in quite optimal time frame. And program teams later on designed and implemented 5 different interventions, and shortly I will tell about each of those. The first one was special programs to support the closed business, the ones that already went out from the market, to come back to the market. Not everybody, the result of it was that not every businesses could afford it, but we had quite many cases by the help of the special support programs for them, which we are really proud about. The other one was, the other intervention was helping the beneficiaries to develop the digital services. And some MSMEs from our beneficiaries even changed profiles, some developed additional online services and increased their sales. So that was in some cases only source of for their survival. Another one was like introducing digital marketing tools, like digitalizing the businesses, and also introducing the e-commerce tools that enable them to link them to the online market and develop their online sales. The other one was outdoor services. What we observed that there was a quite high demand on the market for the outdoor services, and that was also because of the COVID and its regulations. So we designed and implemented the special programs, grants programs for supporting the existing businesses to create and establish additional outdoor services that was mainly in tourism or ecotourism and agrotourism as well. And that also enabled the businesses to concentrate on that direction, and that was a source for them for survival. And the last one that I wanted to mention is like mainly our tourism beneficiaries and tourism actors. We are focused on the international tourisms and the tourists, and their packages and their offers were designed in a way. What we supported in this case is to help them to market their packages and their offers also on the domestic tourism, and we resulted in really increased domestic tourists and the services that our beneficiaries provided. Actually, the same system was applied to in the agriculture field, but the interventions or the response plan was much smaller because apparently the agro businesses in general were more resistant against the COVID. In the final part, what I wanted to tell you as a conclusion, and that's my subjective conclusion according to the experience that I personally gained is not a many professional. And I want to tell you that monitoring and evaluation and learning is not because to have something estimated or calculated or written in numbers or documented. And also monitoring and learning and evaluation is not like separately standing part of the entire project. What I experienced is that monitoring, evaluation, and learning is 100% complementary to effective program planning and implementation, and well-coordinated M&E and program or technical teams, however we call them, is key important, and sometimes even main important part why the projects are successful or not. Thank you very much. That's all from my side.
Thank you very much, Ucha. We have a few minutes left for questions and answers. Most of questions were answered in the Q&A section, but if you have questions, we will be glad to answer them.
So maybe we could share our emails for the follow-up questions in case.
Yes, if you are interested in details of some methodologies or want to contact speakers directly, I will share right now the contacts. Oops. This one. Okay, yeah, we can probably type contacts. Thank you so much for your participation and questions and for listening. Please contact us if you're interested in anything additional information. Okay, we have one question. Were the results very different from the level of trust in other institutions? From Marlene, who wants to take it?
I think this is a follow-up question to the question of the trust and religiosity in Ukraine, actually specifically to things. Marlene, if you don't mind, I could follow up you directly after this. Thank you.
Marlene,
is measuring trust to many institutions, to central and local. We often use this index as well.
And all of the score seed data is open source on their website. Maybe you can type that into the chat, Andre.
Yeah, thank you.
Mhm.
Thank you for the suggestion. I did it, but let me recap it.
Okay, but thank you so much. Have a great day today. And we are closing the recording.